Columbia Morning on News Talk 1400 KFRU. I'm pleased to welcome into the studio one of the physicians from Immu Healthcare, and she's here to talk about immunotherapy. She's an oncologist, Dr. Sindhu Singh. It's nice to meet you. How are you?
I'm pretty good. I'm glad to be here.
Thank you very much for coming today. Immunotherapy is something that I have seen referred to, but I haven't really paid much attention to it. So we'll start with kind of defining what immunotherapy is and how you use it in your work.
Okay, so immunotherapy in a nutshell is trying to utilize body's own immune system to either prevent or fight diseases. So the most common example of immunotherapy is use of vaccines for diseases such as measles, rubella, tuberculosis, things like that. But these days, immunotherapy has garnered much more attention because of its use in cancers. We have used it in kidney cancer, melanoma, lung cancer, Hodgkin's lymphoma, and the list grows. So to understand immunotherapy, we'll have to understand the concept of antigen and antibody. And to give you an example of strep throat. So when you get a strep throat, you get symptoms like fever, sore throat, rash, diarrhea, and they all come because your body is trying to mount an immune response to the infection that it has got. And it does so by recognizing what is natural to the body, what the cells that belong to the body versus what is foreign. So this concept of recognizing what is foreign to the body leads the body to mount an immune response. So this is what our immune system does. However, in diseases like cancer uses certain points known as checkpoints on the immune cells to prevent the immune cells from recognizing cancer. And that's where we are trying to use immune therapy as checkpoint inhibitors, where we can inhibit those checkpoints and the immune system springs back into action and helps combat cancer.
That is a really good explanation. I understand immunotherapy a lot more than I did. How do you turn on, though, or turn off what you just described when it comes to cancer? How do you kind of trigger what you want to see happen in immunotherapy? Is that with other chemicals, with other types of things that would say, all right, I understand that the cancer is sharp enough to say we're the cancer cells preventing this from happening. How do you take down their defense, I guess, that they put up?
So past many decades have been spent in developing drugs such as ipilimumab, nivolumab, pembrolizumab, and these are special antibodies. And what they do is they target special cells or special receptors on immune cells, and they're known as either PD-1 or PD-L1, the programmed death ligand or programmed death ligand type 1. And when they attach to these points, the brakes are kind of lifted off. So this is, past 20, 30 years of research where they discovered that these molecules were capable of turning on the immune system. Now, if you look at diseases like autoimmune diseases like rheumatoid arthritis or lupus, there they use drugs such as prednisone, steroids, or Cellcept, where they can actually turn the immune system down because those are autoimmune diseases. So,
is immunotherapy working better now for certain types of cancers than other types of cancers?
Yes. So we have seen some very awesome responses in lung cancer, kidney cancers, melanoma, especially diseases which what we call as high mutational tumor burden or more number of mutations respond better to immunotherapy than the ones which are slow growing.
Do you have to catch it at a certain stage, or if you catch it late and start immunotherapy, is it still as effective?
So right now we are using immunotherapy mainly for advanced cancers. So it is approved in first line, stage 4 lung cancers, kidney cancers, melanoma. So yes, those are late stage cancers.
For certain ages or any ages?
Mainly for adults right now, but the trials in the child population are growing.
So what have you seen? What are the results? Positive? Are they still questionable? Where's your confidence level with this?
Extremely positive, because we have seen a number of incurable patients, the stage 4 patients who would have otherwise not been cured with either chemotherapy or radiation alone are now going on to enjoy many years of disease-free life. And we are expecting that the cure rate in these patients will be high. So stage 4 cancer, which was previously incurable, now we are heading towards a cure.
Is it different for you would have to figure out what immunotherapy would work best for me, and then for a different patient it would be different? Is it personalized in that way?
So that is the beauty of immunotherapy. It's not really personalized. Like, for example, a drug known as pembrolizumab, I can use in bladder cancer, lung cancer, head and neck cancer, and its role in triple negative breast cancer is also coming. So it's a little bit different than personalized medicine. The personalized care is also growing, but immunotherapies, there are 3 or 4 drugs right now which can be used for a number of cancers.
If somebody starts immunotherapy and it is working and it is defeating their cancer, are they on that for the rest of their life?
So right now, the technical answer is yes, but most people, in my clinical practice, if somebody has been in remission for, like, say, a couple of years, we do try to give them a break and see if the cancer comes back. In most cases, I'm seeing that the people do stay in long remissions.
So what's the future? What will change with immunotherapy?
So immunotherapy is able to, cure maybe like 10 to 15% of cancers, but to increase the cure rate, we will need to utilize it to combine with chemotherapy as well as radiation. And we have already approved it in diseases like lung cancer. But the future is that we combine it with other personalized targeted drugs and also radiation to increase the cure rate of cancer.
When somebody comes into you with a certain, what you described as the cancers that would be most, perhaps what you would feel like immunotherapy would be most effective with, do you start with that, or do you start with the other treatments that would be the more, I guess, traditional treatments?
So these days we are combining traditional treatments with immunotherapy. Like for lung cancer, I would combine chemotherapy with immunotherapy.
So when people are listening to this right now, what would you hope that they would hear?
Well, they would hear that there is hope. So if you're diagnosed with stage 4 cancer, don't lose hope, because there are lots of new exciting treatments on the horizon. Take good care of your health and, find a good physician who's well-versed in these areas. And, there's a lot of hope on the horizon.
Lifestyle changes also play into this. In other words, diet and physical activity. Does that also kind of work together with immunotherapy to see some of the good results?
Yes. For example, smoking is never good. Like, smoking will depress your immune system. If you are overweight, there are 8 guidelines of WCRF expert guidelines where they say that you stay within lower BMI, exercise daily, lower your stress levels, avoid red meat, avoid smoking, and things like that. So that's a huge topic of discussion itself.
How often would you say immunotherapy is being used right now at Immu Healthcare?
Almost all the diseases, very frequently first line.
It is. Anything else that I didn't ask you that you'd like to say?
No, I think the future looks glorious.
Immunotherapy, that is one of the things that I think we are being educated on, because how many years have you been doing immunotherapy?
Now about 5 years.
5 years. So it's not that, it's fairly new. I mean, I would call that
fairly
new. 5 years would be pretty recent. Well, Doctor, thank you very much for your time today.
Thank you. I'm glad to be here.
Talking about immunotherapy, our guest has been Dr. Sindhu Singh, oncologist from University of Missouri Healthcare. You're listening to News Talk 1400 KFRU.